All right. Good morning. Good morning. Thank you. It is really my pleasure to welcome you to our Fall Chosen Forum. My name is Susan Hwang. I'm a neonatologist here at the Anschutz campus, also on faculty here at the School of Medicine. I am so excited to see all of you in person. Woo! Can we get a round of applause for that? I was chatting with Cassie Davis, who really is the backbone of these forums, and she and I remarked how we have planned 5 virtual forums together since March of 2020, and this is the first time we've held it in person since the start of COVID. And so it is really, really wonderful to see all of you. We have quite the agenda for today. For the first half, which will be hybrid, we'll have several presentations from the speakers locally as well as nationally. I won't go through this entire agenda, but please know that it will be a hybrid presentation and will also be recorded. The afternoon will not be hybrid, will be all in person, will be more interactive breakout sessions. Will be in this room and one held upstairs into smaller groups where we can really get much more in the weeds about how to do some of this work. Now, I really do hope that today is a day where we cross silos. I think we've become more and more aware of how isolated we can be within our own campuses, our own organizations, our own facilities where we work, and that this truly does limit how we can best serve our mothers, babies, and families affected by substance use. And so I hope that today is a continuation of this picture on the left, where we are just starting to think about moving into uncomfortable places where we normally don't reside. And my hope is that as this work continues, that this very somewhat fragile connection that you see between silos becomes much more robust, and that there is a natural fluidity and crosstalk between all the organizations that we represent here today. And so with that, I do want to give a shout out to the various organizations that are represented here. So those of you that are in healthcare, let's see your hands up. Ooh, a lot in healthcare. Those that are with our various public health organizations, CDPHE. All right, maybe they're joining virtually. Nonprofits. All right, fantastic. Those that represent our families and those with lived experience. Thank you, Diane. We so appreciate all that you've done for Chosen and for the state at large. And then lastly, what about community advocates, advocacy partners? That was a trick question. You all should be raising your hands. Come on now, if you're here at this forum, you are advocating for a cause that is greater than your own. And so truly, we are all advocates in this work. Now, with respect to the silos, I want to share 2 sort of personal experiences that I've had in recognizing my own siloed position in this work. And while I've been doing chosen work since 2017, I recognize still to this day how isolated I can be in my own work. Shown on the right is just a recently published article in the New York Times, and it focuses on how there's a federal push to better support families who care for infants with substance exposure, but as kin, not necessarily in the foster care system. So these are family members of the biologic parents of these infants. And what was totally surprising to me is that these families are not as well supported financially, socially, etc., economically, as those that are foster parents. And to me, I could not wrap my head around how this could be. And I think back during this COVID epidemic in particular, where in the neonatal intensive care unit, I took care of dozens of infants with prolonged hospitalizations who were in the NICU for a number of reasons, but they were impacted by prenatal substance use. And they went home with kin, not with their bio parents and not into foster care. And in thinking back, never did I ask any of those kin family members who were taking this medically vulnerable infant home, do you need anything to take care of this baby? Do you feel supported enough to take care of medically as well as socially and financially for this infant? And so I was completely unaware that this was the state of kinship care in our country. The second piece that I'll share with you is related to our data linkage project. So this might be familiar to some of you. Shown on the left is a very brief summary of what the data linkage project is. It was published in March 2021. It was a collaboration between Illuminate, Chosen, as well as the Colorado Lab that's based at the University of Denver. It was a linkage analysis that linked infant vital statistics, birth certificate data, death certificate data, along with child welfare data. We identified infants that were prenatally substance exposed and looked at a number of different outcomes. And what was surprising to me then, and even is now, is that those infants that we identified with substance exposure had a rate of being low birth weight of 25% within this cohort. Compare that to the state average of 9% of all newborns in our state. Secondly, very low birth weight. So these are infants that are less than 1,500 grams. Among the substance exposed newborn group was almost 3% of that cohort, compared to 1.2% of the general population. Now, by a show of hands, how many of you knew these statistics? Right? Surprising. And yet, nearly all of you raised your hand saying that you worked in healthcare. So why do we not know this? And it also then pushes me to think, what can we do for myself in the neonatal intensive care unit, excuse me, to better support these families? As they are in our NICU for a prolonged period of time. And yet, in the midst of the craziness of neonatal clinical care, we are not thinking about how do we best support families in that transition home and then in the months to years after discharge. So I share these two very personal examples for myself, demonstrating that I've been working in this field for quite some time, and yet there is so much that I do not know and so much that I still need to learn. So I really hope that you take this opportunity today to interact in person and learn more about each of the organizations that you all represent and find actionable opportunities to break down barriers, cross silos, and collaborate. Now, with that, it is truly my pleasure to welcome Phil Weiser, our Colorado Attorney General, to offer opening remarks. Colorado Attorney General Phil Weiser was sworn in as our state's 39th Attorney General in January of 2019. Before running for office, Attorney General Weiser served as the Hatfield Professor of Law and Dean of the University of Colorado Law School, where he founded the Silicon Flatiron Center for Law, Technology, and Entrepreneurship, and co-chaired the Colorado Innovation Council. He served as a Deputy Assistant Attorney General in the U.S. Department of Justice and a Senior Advisor for Technology and Innovation in the Obama administration's National Economic Council. Before his appointment at the Justice Department, Attorney General Weiser served as a law clerk to Justices Byron White and Ruth Bader Ginsburg at the United States Supreme Court. As the state's chief legal officer, Attorney General Weiser is committed to protecting the people of Colorado through innovation and collaboration, addressing a range of statewide challenges from addressing the opioid epidemic to improving our criminal justice system to protecting consumers, to protect our land, air, and water. So thank you so much, Attorney General. I know you're quite busy and we appreciate you being here.
It's an honor to be with you this morning. I do want to start by acknowledging Jamie Feld, who's here. She's the Deputy Director of our Opioid Response Unit. She's doing extraordinary work, and two real leaders who we're able to work with, Jade Woodard and Kathy Wells, who are leading an important subcommittee of the Substance Abuse Trend and Response Task Force. The opioid epidemic is one that I have focused on intently over the last 5 years. The amount of trauma and impact that we have had is one that I don't think we've fully processed, acknowledged, and that's because there's so much stigma. Whenever you have an issue that has an impact, but you don't want to talk about it, you don't acknowledge it, and you don't effectively address it. This is not alone. I could say the same thing about domestic violence, an area where there's a lot of stigma, there's a lot of pain that's kept in the shadows. Opioid use disorder is still an area there's a lot of stigma. There's a lot of reluctance to acknowledge different struggles. When you talk about babies who are born, whose moms have struggled, you are in a focal point. In the best of all worlds, at that point, a mom may say, I want to get well because I've got a baby to take care of. And we may recognize not just the medical impact, but other, what you might call socio-emotional impacts that the baby is going to have in a household where, generally speaking, if someone is struggling with addiction, there's challenges going on. How do we as a society respond in that moment says something about us as a society. The lack of a response in that moment will be felt because that child is going to grow up in the shadows of what happens in that critical moment. So this issue is one that merits our attention. And the broader challenge of the opioid epidemic truly is a crisis that hasn't been met with the urgency it deserves. To give you one indicator of this crisis, in the last year we have the records, more Americans died of drug overdoses. Most of that is from opioid abuse of some kind. Increasingly, it's fentanyl driven. Then car crash deaths and gun violence deaths combined. So when people talk about public health emergencies that are killing people, for generations now, we've been talking about automobile safety and we've made progress. We need to talk a lot more about gun violence prevention as a public health issue and give it the urgency it deserves. This opioid crisis is on the ascendance. More people are dying than ever before. It's a 25-year story. It's a tragic story. It didn't have to happen. It hasn't happened in other countries. It started in the boardroom with companies like Purdue Pharma, now with Dope Sick out there in this book, Empire of Pain. And we, in a settlement with Purdue Pharma and with McKinsey, are making them put their documents out there so we tell the story. How did this happen? It's predatory capitalism is what it is. It's companies who said we can make money and people are going to suffer, but we'll be rich by then, and which is exactly what happens. The Sackler family, Purdue Pharma, Johnson & Johnson, McKinsey, they made money enticing people into a path of addiction by misleading them and then leaving them and their families to suffer. After that decade of pushing out these pills, cartels in Mexico thought, we have a market, and they pushed out heroin. And a lot of people, I know you probably know people who started with pills and moved to heroin, and I've heard from people who've lost loved ones. The latest scourge is now counterfeit pills that are actually fentanyl, but need to look like they could be an oxycodone pill or a Xanax pill. The urgency that our office is taking is worth underscoring. We did take on these companies and held them to account. $520 million are coming back to Colorado, and we're still working on more. We now have set up 19 regional collaboratives, and they are going to make decisions knowing the money we're bringing back through these settlement funds is not enough to meet the challenges of this crisis, but it's a start. And those collaboratives are asking, how can we get more money? How can we do all the things we know we need to do? And most importantly, this is the point I want to end on, how do we build a sort of interdisciplinary relationship outside of our silos to give us the breadth of vision, including from people with lived experience? This work is happening now. If you're not engaged in this work, you can talk to Kathy, you can talk to Jade, they can help plug you in. We are at a moment of opportunity with funding, with urgency, and with creative problem solving all on the table to address what truly is a public health crisis. I'm so grateful for your work in this area, looking forward to finding ways to collaborate and support it. Kathy, Jade, thank you for your leadership. It's an honor to be able to celebrate what you're all doing. Thank you all very much.